Thanks very much, and welcome to our live newsletter on the terms of reference recommendations put forward by the chair to the Prime Minister. So today's session should last around 40 minutes, but I'm going to make sure it takes no longer than an hour. We'll be all done by 7 o'clock. And we're adopting a format that's very similar to previous sessions that have helped our clients get to grips with where they stand on the COVID-19 Families for with where they and the COVID-19 Families for Justice group stand with the ongoing legal process. So the idea of this webinar is to offer our views on the recommendations put forward by the chair to the Prime Minister, and those recommendations were made following the chair's discussions on the inquiry's terms of reference with the families. There will be an opportunity for you to pose questions at the end, and those are questions that you come up with as the webinar proceeds. So let me just introduce the idea of this live newsletter for you, because there'll be people on this webinar who haven't attended previous sessions. So I just want to explain that the team at Brodie Jackson Cantor are already sending our clients who've asked us to represent them regular email updates. This session is simply a kind of live version of that, run in a format that's designed to allow us to update you on what's happening as the inquiry process proceeds. What we're also going to attempt to do here is interpret what the various developments mean to bereaved families. And finally, as I said, give you the opportunity to ask questions at the end. So I just want to reassure you, if you want to ask a question, then your identity will not be shared. I'll explain how you can do those questions in a minute, but before I do that, I just want to invite Elkan, if you're there. Elkan's still there, who I think most of you probably already know. Elkan, can you just introduce yourself and Pete, and just say a couple of words? I know we've got Nicola and a few other people on. They're not going to play an active part in this, but just give us an idea of who else we've got from the team on the webinar, please.
Yeah, good evening, everyone. I'm Elkan. I'm a director with Brodie Jackson Cantor, and I'm the lead on the public inquiry team at the moment. Pete Weatherby is the QC, who is the lead on the council team. You may also see names for Kate Stone, who is a junior counsellor, and Nicola Brooke, who's a solicitor. Nicola's just joining our team from the Manchester Arena inquiry that she was winding up. And Kate was at a previous webinar. Nicola and Kate are really here as observers this evening because it's going to be mainly the Pete Weatherby show.
There we go. Okay, quick word on confidentiality then. So everyone on today's webinar, all of us panelists, we're all bound by the same duty of confidentiality. Live questions for Pete and Elkan can be asked via the Q&A button that you should find at the bottom of your screen on the right-hand side of the options. Click that button, type in your question. As this session, now this is a difference from the session we've had before, this session is principally going to involve Pete and Elkan explaining what their thoughts are on the chair's recent recommendations. We'll do Q&As at the end, but we'll limit those to answering questions on topics we've not already covered. And we'll also do that if we've got time. Everybody, however, who asks the question, you will get a written answer to your question if you make it in that box in the couple of days after the live webinar. And we'll also be adding your questions to our Q&As on the website. So the attendees on today's webinar, as far as we know, are all clients of Brodie Jackson Cantor and members of the COVID-19 Families for Justice group. This isn't a session at which we answer questions on individual cases. So just to remind you, if you've got a question about an individual case, you can contact us directly. You should just come direct to the team with those. As I said, all questions asked are anonymous. No details will be shared. The webinar will be recorded and edited if necessary to ensure that the recording doesn't include any client's details. The recording will then be sent to clients. So don't worry if you miss anything. If you're a client, you will be able to watch the recording. And then finally, just to reiterate, there is quite a comprehensive list of Q&As, questions and answers, that pretty much cover every question we've been asked since this process began. And that's on the Brodie Jackson and Cantor website. It's a really exhaustive list, and it will be updated at the end of this session with any Q's and A's from the live part of the session. So if we don't get to your question in this session, please don't worry, you will be answered personally. Then if your question is of general relevance, it will be added to that list on the website. Okay, so here we go. We'll go with the live Q&As now. So essentially, in this section, Elkan and Pete are going to answer the questions that have naturally arisen from the chair's recommendations to the update of the terms of reference, along with some answers to a few questions that were pre-submitted. So I know a few of you, thank you very much, sent us questions in after you got the invitation email. So this section is going to cover pretty much three of the most important items: the scope and effect of the recommendations, the Prime Minister's role, and a couple of general queries and what's next. So there we go. To kick this section off, Elkan, can I just ask you, please, to explain what's happened since the last live webinar we did, and maybe give us a bit of insight into what happens when you joined the chair on her tour around the country to see the bereaved families?
Yeah, sure. It's been on since the last webinar. The most important thing that has happened is the public consultation, and in particular the role played by the CBFJ and its members in that consultation. We with the group provided almost every bereaved family that the chair spoke to, and more or less the group helped the inquiry manage that consultation process as well. And a number of points were put across, and my view, I know a lot of you here will probably have been involved in that consultation. My view was, first of all, that it was well managed by the inquiry team, sensitively managed as well. And secondly, more importantly, that the chair, Baroness Hallett, wasn't just going through the motions. She seemed to listen and take seriously what everyone was saying to her. And a lot of what was said has fed through to her recommendations on the amended terms of reference. There's another point I'd like to mention as to what's happened since the last webinar, because it does illustrate the power of the group. We've obviously been in consultation with the legal team for the inquiry, and one of the things we asked them was, when Baroness Hallett sends her suggested amended terms of reference to the Prime Minister for him to approve or not, will you let us see them? And the reason we asked that was so that we could identify any particular issues which the chair had suggested should be in the terms of reference and which the PM didn't accept, so that we could then put political pressure on the PM to accept them if we thought he should. Now, we were told, Pete and I were both told separately, that wasn't going to happen. In other words, she wasn't going to share the proposed amended terms of reference. There was an all-party parliamentary group meeting. This is the APPG on the COVID, and that was at the end of April, 26th April, and Rab and I went there. And the reason we were invited, of course, was because of the status which the group has, and the reason the group has that status is because of its members. And one of the points I made at that meeting was that although the consultation process had started in the spirit of openness, and Baroness Hallett had made a number of promises about being open, that was already starting to dissipate. And I said we were transitioning from participants to supplicants. That was picked up by The Guardian. And then when just before the terms of reference came out, we were told, oh, of course you'll see these terms of reference when they go to the Prime Minister. So there was a complete shift in stance by the inquiry. And that shows the power of the group and the power of its members. And that's something that's worth bearing in mind going forward. Another thing that we're trying to set up is an all-party parliamentary group on accountability. And that's to deal with a few issues. One is duty of candour, which Pete and I have banged on about at previous meetings, but we can talk about again if you want. And it's also hopefully going to set up a monitoring process for inquiries generally, but this inquiry in particular, so that any recommendations that come out of the inquiry are reviewed to see if they are in fact implemented. That's in its early stages at the moment. The only other thing, and I'll mention this in next steps, is we're due to meet the lawyers to the inquiry on the 30th of June, together with the lawyers from the devolved territories. And there are a few points that will probably come up this evening that we will take to them. So that brings us up to date, I think, Andrew, if you want to go on to the
30th of May, Elkan.
May, sorry. Yes.
The 30th of June.
No. Sorry.
Okay, well, that sounds like some good news in there anyway, that we're got a bit of sway there. So Pete, let's crack through these questions we've got here. So number one, first set of questions is on the scope and effect of the recommendations. Can you just give us an outline, number one, on what the principal recommendations that have been made by the chair actually are? What are those principal recommendations?
Yeah, I'm happy to do that. Just by way of preamble, can I just agree with Elkan that there are positive signs here. I mean, this is going to be a process where there's going to be good and not so good things happening, and it's our role in working with you just to try to move things along and push things in the right direction. And Elkan's given you the excellent news about the transparency and pushing the inquiry to be transparent as it's promised. In terms of the terms of reference, let's just remind ourselves, the terms of reference are the scope of what will and won't be looked at by the public inquiry. So it's very, very important that we get off with terms of reference which are capable of covering everything which you want investigated by the inquiry. And that's why we put so much effort into it. And that's why we came to you, I think, over a year ago, and proposed our own terms of reference, and then went back to you in January and updated those just after Lady Hallett was appointed. The current process, as you'll recall, is that the Prime Minister issued his draft terms of reference in March, and he's required to consult with the chair, not with you, but with the chair. However, it's common practice now and good practice that a chair will consult with stakeholders or people with an interest in a public inquiry. And of course here, you are the people with the front and central primary involvement. So that's why the process has happened. And the product of that is the documents that you can see on the inquiry website, which is the letter from Lady Hallett to the Prime Minister and the document which sets out what she thinks of his draft and what should be added. So I'm not going to go through it all because you will have seen those and we've referred to them previously. I think just again, finally, as way preamble, they were quite untidy and set out in a different way to that which we thought was appropriate. But Lady Hallett has listened quite carefully, I think, to the families, but also others that she's consulted with, and she's made a whole series of proposed additions, many of which have come from us, which is good to see, some of which have come obviously from elsewhere, but generally positive additions. So she's asking the Prime Minister to add investigating the effect of the pandemic on young people more generally. She's asking him to add unpaid at-home carers to the social care section of the terms of reference. She's asked for specific reference to be made to the 111 and 999 services because that's something which many families have raised as a concern. She's asked for GP and other community healthcare settings to be added to the healthcare section of the terms of reference. And she's asked for greater specificity of matters relating to care home management. I'll put my teeth back in a minute, particularly in respect of infection control, workforce testing, transfers, visiting, and changes to inspections in care homes and other such facilities, which again is something that we asked for. She's added vaccines and therapeutic development and delivery and impact. She's strengthened the language covering the use of data and expert evidence in decisions made by government and other public health and care home sectors. She's added specific reference to decisions, how they were made by government and others, and also importantly, how and where they were recorded, which is obviously vital to an inquiry process. She has indicated that she doesn't think that anything needs to be added to the section on government messaging. But that's for a good reason. It sounds negative, but it isn't. It's quite positive. And she says that nothing needs to be added to that because the points that have been raised with her about government messaging, she considers are adequately covered. Given that she's the head inquirer, that's a significant and helpful explanation that she's given. She's proposed adding the impact on the mental health and well-being of the bereaved and including bereavement support, which again is welcome and what families have asked for. She has agreed that the inquiry should be broadened to look at the policing response to lockdown restrictions, in particular because of the perceived disproportionate application of measures to Black and other minority ethnic communities. She's proposing adding safeguarding and support for domestic abuse victims within scope. And finally, she has proposed further clarity on economic issues, including the impact of measures taken on the hospitality and tourism industries, effects on the self-employed, the impact of measures on places of worship and cultural institutions. And she's indicated that other concerns, including key workers and those in the gig economy, which are very, very important to bereaved families, she's indicated that she considered that all the points that we've raised about those are already sufficiently covered, which is, again, good news. So that's a bit of a whistle-stop tour because of the time we've got. But those are the key recommendations that Lady Hallett is making to the Prime Minister.
Okay, so there is, I was starting to write those down. There is a lot in there, but I think in that you kind of said she was tightening the whole scope up. Were there any other reasons you give us for why the chair made so many or made any of the particular recommendations that would be useful to let people know about?
Well, I think you know, why has she made these recommendations? Because first of all, she's been provided by such clear accounts by the families in particular, but also by others. And secondly, as Elkan said earlier, I think the good news is that she has approached this as a proper consultation. I mean, you know, as a lawyer, I can tell you that many consultations are people going through the motions, but it does appear that on many of these issues, Lady Hallett has listened and is prepared to say to the Prime Minister, not good enough, you need to go further. And that puts tremendous pressure on him. So I think that's in short order why she has made these recommendations. I
think that's interesting because actually, Pete, someone has put in the chat, someone was one of the people who met with Lady Hallett in Edinburgh and felt that she did listen well and things that we spoke about have been considered and made clearer in her proposed additions to the terms of reference. So I think people who met her on the tour that Elkan was on seem to be agreeing with that she is, you know, this isn't just sort of a lapdog making you know, ineffective changes. It seems to be people agreeing with that. Okay, so Pete, given the number of
sorry, can I interrupt?
Of course,
I can see my hand raising. Just one interesting point about these recommended additions, and it's under the section enforcement of lockdown restrictions, and she's added the words. She was looking at legislative and regulatory control. That's what it was originally. She's now added the words and enforcement. And she says, the reason I've added that is because people have asked me to look into how the regulations were enforced, because they were enforced differently in different areas and perhaps with different ethnic minority groups. The Daily Mirror, or it's just called the Mirror, isn't it, seems to have picked that up and says, Chair asked Boris Johnson to agree to COVID inquiry looking at Partygate, and has quoted someone from the inquiry team saying she wants to determine whether actions influence public behaviour. Now, I don't know if that's true or not, and it is the Mirror, so you have to take it with a pinch of salt. But it's interesting that they've interpreted it that way, and we may want to adopt that interpretation as well at some point as well. So it's quite an interesting change there, I think.
Cool. Okay, thank you very much. So, Pete, given all that number of recommendations, what's your view on the recommendations? Are you agreeing with them? Do you agree with some of them? What's your overall kind of view on what's gone to the Prime Minister?
Well, I think that it would be right to say that you can see many of the recommendation came straight from the points raised by families in the 11 meetings, and in the document that we sent to Lady Hallett, sweeping up those points and setting them out, in one document. So I think that's very positive that she really has listened to us, to the bereaved families. I do want to temper this a little bit. This is a long road, and I'm very happy to be positive about Lady Hallett when she does the right thing, but I anticipate I won't always be saying that. So I don't want people to get too carried away about this. So I think it would be right to say that we're generally positive about the terms of reference and how they appear to be landing, and how Lady Hallett is orienting towards them, because everything that we want covered is either covered or is capable of being covered, and that ties into the point that Elkan's just made. And very importantly, nothing is excluded, which is when it becomes really problematic, and then the inquiry doesn't have any discretion. However, the scheme of the final proposed draft is very different to that which we proposed, and some of the points remain unclear. So there is work to do down the path. And a key point here for me is preparedness, in that we split the proposed terms that we put forward into preparedness and response, or all of those issues up to the onset of the pandemic and all of those thereafter, the response to it. And that just seemed to me to be the logical and blindingly, glaringly obvious way of doing it. But unfortunately, that doesn't seem to be the way it's going to land. Having said that, preparedness is mentioned a couple of times. And therefore, we can certainly very much take that forward and try and ensure that everything is concerned. My concern is that the inquiry will look rather superficially at whether the UK and the devolved administrations were sufficiently prepared, or whether they will narrowly interpret preparedness in terms of things like the number of hospital beds that were available. And that's my concern. So yes, I have concerns, but generally I would say positive. And finally, Hallett has emphasised that she will take an inclusive approach to the terms of reference, and she will treat them with flexibility. And those are two quite important points, in that she will try not to exclude things that we can rationally say should be included in the inquiry.
Does that mean there's still some wriggle room then, in terms of if there are things that you're not seeing there? Are you saying that there may still be an opportunity to squeeze those?
Yeah,
that's probably a terrible way of putting it. But
no, that's precisely the way, precisely the point I'm making, is that nothing is off the table.
Right. Okay.
And where things aren't clear and aren't expressly on the table, we've got further opportunity to persuade Lady Hallett, either in the coming weeks or even further on than that, to include them in scope. And that's frequently what happens with inquiries. And I think in a moment or two, you're going to ask me about a list of issues, and that's relevant to that.
Yeah, we'll come on to that in a minute. Before I get to that, so yes, I am. If all of those recommendations are adopted, what overall effect does that have on the inquiry? It kind of, you've kind of said, well, we're giving us, does it mean we've got even more wriggle room? Does it just make it an interminably long process? What if all the recommendations and the Prime Minister doesn't, agrees with the whole lot? What happened? What does the inquiry change shape or form or anything like that?
No, it means that there's greater clarity, and there are more of the issues that the families want in there included, and none of the issues, so far as I can see, that the families want have been excluded. So even where it's not very clear, we've still got room to argue them in. So in terms of will this make it longer? No, this is just part of the normal process.
Yeah.
And right from the beginning, as I think everyone will remember, we've been arguing that Lady Hallett should set a time scale, not just a timetable of what will happen, but she should keep the overall length of the inquiry manageable, because that's something which has been a problem with many other inquiries. And she has bitten on that, and she specifically refers to that in this document, the report on the consultation process. And she says that she agrees that there needs to be a timescale, and she'll give that further consideration and hopefully after further discussion with us. So I think that's pretty positive as well.
Okay, cool. Okay, thank you for that. So yeah, so you mentioned the issues, the list of issues. Do you want to give people a very quick synopsis of what the list of issues are, and then give us your view on what's going to happen with them?
There's a very good reason why it will be quick, which I'll come to in a moment. But under the statutory scheme, any inquiry, including this one, the scope of it is set by the minister in the terms of reference, and that's why there's so much importance to this discussion. But in practice, once the terms of reference are set, in practice, inquiries generally set out the scope in more detail in lists of issues. So that just clarifies it more for everybody else. So that's when we get a real second go, if you like. And we'll say, well, hang on a minute, that point that wasn't specifically mentioned is really included because it's in that part of the terms of reference. Now, we've been told when we've argued with the inquiry team about some of these points, oh, don't worry about that, there'll be a list of issues coming down the track. And so I've said, well, great, I don't want to worry about it. So can I have a look at the current iteration of the list of issues? And I'm afraid the answer so far has been no. So I can't tell people what's on the list of issues, but that will be much more, I hope, will be much more detailed, and it will give us a further opportunity. And it's a normal way of doing it. And it's kind of a checklist for the inquiry and for us to ensure that nothing is missed.
Great. Okay, cool. Thank you very much. Elkan, do you have anything else on the scope and effect before I move on to the questions on the Prime Minister's role on this?
Just this, there seems to be a lot of discussion among the participants about the DNR issue, the do not resuscitate. And that was raised, I think, at every single meeting I was at with the chair, and she seemed genuinely shocked by it. But it's not mentioned, as people are saying, it's not mentioned. Now, the reason I hope it's not mentioned is because it's going to be in the list of issues. And there may be one of the decisions the chair has to make in her recommendations is if I recommend something specific and the PM says no to it, I'm then stuck. I can't squeeze it in later. So it may be she made a decision not to mention it because she was concerned that it might be specifically excluded by the PM. I just don't know. It may be that she thought it was so obviously an issue that it didn't need mentioning. I would be surprised if it doesn't appear, or I would be surprised if it isn't dealt with in the inquiry. And if there is an attempt by her to dodge that issue, we'll certainly be challenging that when the time comes.
Okay, cool. Right, yes, I was picking up the DNR thing as well, so thanks for covering that off. That's great. Okay, so let's move on to the Prime Minister's role. So, Pete, number one, why is it up to the Prime Minister to agree the terms of reference when he is the one whose decisions are being scrutinised? And you see quite a lot in that in the chat going, you know, that it's the guy that's being scrutinised that seems to have some control over the process that's scrutinising him. So why is it the Prime Minister? Why is it up to the Prime Minister to agree to his own questioning?
Well, before I answer that, can I just go back to the previous one? In fact, DNA CPR decisions are mentioned in the draft. And it comes under the management of pandemic in hospitals. So I'd be amazed if Lady Hallett isn't going to look at the DNR position. Absolutely, we will be going to town on that if there's any hint that she isn't. In terms of the Prime Minister, don't shoot the messenger here. This has always been a problem with this law. And when it was passed in 2005, there was great controversy about the fact that ministers set the terms of reference, and that affected the independence of it. And that criticism was absolutely right. It came from people like Amnesty International, but also from senior law lords at the highest level of the system. So it's right across the board. Very often it doesn't really matter, because a minister is setting up a public inquiry on an issue where he or she didn't have any direct decision-making involvement. But that isn't the case here, because this inquiry will be to a significant degree about the Prime Minister. And so therefore, in kind of legal structural terms, that is an obvious problem. However, better news is that once we get past the stage we're at, the setting of the terms of reference and the blowing the whistle on the formal setting up date, the Prime Minister then, although he's established and set the terms of reference, he then loses control over most of the process, and the baton is passed almost entirely to Lady Hallett. So although I completely agree with the comments that are made, this was a badly worked out law, I don't think in terms of the COVID inquiry it's likely to make any real problem, save that there could be further delay because Johnson may choose not to sign it off for another month or 3. But of course, the campaign, will be doing everything we can to push it. And indeed, Lady Hallett has already urged Johnson to deal with this urgently. That's
interesting, actually. We've not got a question on time. We've got a question on what happens next, but the timing for this next stage, its immediate next stage, is actually completely in the hands of the Prime Minister.
Yeah, I mean, yes, I mean, you know, the ball is rolling. He's appointed a chair, and he's provided resources for an inquiry legal team. So it would be very difficult for him to delay it for a long period. But all through this, as we know, he's caused enormous delay. I mean, you know, it's 2 years now since the inquiry demands were really first beginning to become a clamour. And he's at every juncture just punted it off and tried to delay things. So I can't rule it out, but I don't want to put too much emphasis on delay. There isn't an awful lot we can do at this stage. He can legitimately say he needs to think about Lady Hallett's recommendations. He can legitimately say he needs to consult with other ministers. He can legitimately say he needs to consult with the devolved administrations. So he can get the book of excuses out, and as we all know, he's regularly doing that on other issues. He may well try to blame the Ukraine crisis or the cost of living crisis and say that it's on the agenda, but quite a long way down. But having said that, the recommendations are not earth-shattering, and therefore I'm optimistic that there won't be too much further delay, but I can't rule it out.
Well, I guess that kind of follows on to my next question then. So do you have a sense of what the Prime Minister's likely to do with the recommendations? Do you have any, I mean, I know, God, see inside Boris Johnson's head sounds a bit of a nightmare.
Yeah, well,
is he likely to agree everything, or can he exclude everything? What do you reckon he'll do?
I think in practice that we're probably not dealing with Johnson. We're dealing with the cabinet office and people within that. I think it'd be quite difficult for them to disagree with Lady Hallett's recommendations. I think it's more likely than not that they will accept them all. But again, that is a guess. I've no way of knowing. But she's drafted them quite carefully. I don't like the scheme of the original draft, and I wish she had made more radical recommendations to set it out more logically, as indeed we had, but she hasn't. One probably favourable outcome from that is it's easier or it's more difficult for Johnson to object to it, if you like. So yeah, so I can foresee there could be further delay. But at the moment, I think it's unlikely that he will rule anything out.
Okay, so I understand you're saying it's unlikely he'll rule anything out. If he was to rule something out, what would the situation be if the Prime Minister did actually reject some recommendations that we thought were actually quite important? Is there an appeal, or is that?
Well, there isn't an appeal. There was no obligation to consult with the families. There was an obligation to consult with Lady Hallett, but there was no obligation to agree with her. And that, I'm afraid, is a problem with the law and the lack of independence, where the minister is at the heart of the matters that are being investigated. So if the Prime Minister rejects some or all of the proposals, then there is little in the way of a legal challenge to it if that happens. But Lady Hallett might be persuaded to have another go. We can go back to her. And also, she will have a substantial discretion once the inquiry starts to shoehorn issues into it if she chooses to. So it's not easy for the Prime Minister to exclude things at the moment. And so I'm fairly optimistic about it.
Okay. So I think we've kind of sort of covered this in terms of, my next one was, how long will it take the Prime Minister to establish his terms of reference, then get on with it, and what happens after that? Do you have a view on that immediate, or do you think we've covered that already, Pete?
Well, I think it's impossible to say whether the Prime Minister will try to delay things further. I mean, that, past behaviour would suggest that, but he is kind of running out of road on delay here. And so it's difficult to say when he will do it. But there's not much we can do about it apart from shout loudly and get MPs to regularly raise it in the House of Commons, and friendly journalists to report, and the campaign to do it. And of course, I'm sure that's what will happen if he doesn't sign these off within a week or two. So I think there is real pressure on him, and he's running out of road in terms of delay.
Brilliant. Okay, thank you for that. Okay, so that's all my questions on the Prime Minister's role. Elkan, are you happy with that? You got anything else you'd like to add in there? You're on mute, Elkan.
The only thing I'd add is, if there are points that he doesn't accept, as Pete says, they might be squeezed in anyway, depending on how specific the points are. She can always request him to reconsider the terms of reference at any time during the inquiry. And I think we're in a good position to put political pressure on him. We can't guarantee the effect of that, but I think he will be under some pressure if he refuses to accept some of the recommendations. Okay, cool. So on to our last three sort of put up here questions. So general queries. So number one, devolved territories and issues that are relevant to them and their own inquiries. What about those? Are they covered, or is that going to be a separate task? Well,
we asked Lady Hallett very directly to raise this, and regrettably she hasn't. What we said to her is that although constitutionally it's not up to her whether there are devolved inquiries, what we said to her was the fact that the Scottish government has decided to have an inquiry, and so far the Northern Irish and Welsh governments have decided not to have their own inquiries, will lead to an asymmetry, which will lead to an unequal investigation in respect of the different devolved areas. And we also said to try to get her on board, really, although it's completely correct, is that it will be extremely difficult for her and her team to deal with the devolved issues as well as the UK issues. And we asked her to raise that both with the devolved administrations and with Johnson, and she has rather ignored that. So we're discussing at the moment with the legal teams that we brought in for Scotland, Wales and Northern Ireland, and of course the families from each of those areas, what to do about it. And over the next week or so, I hope we'll have a bit more of a plan. But one of the things that I'm keen to do is to have another go at saying to the Welsh and Northern Irish administrations that it's in their interests, because otherwise Johnson will dump on them and blame them for shortcomings that happened in their areas, and so they will lose control over that. Before anyone says, I am well aware that there isn't really a Northern Ireland administration at the moment, given what's going on after the elections. But constitutionally, there's still a health minister, so there is still somebody to go at.
Okay, so okay, we don't know, but so will the inquiry, if there aren't inquiries in some of the devolved administrations, will the legal inquiry team in the one that we're involved with include Welsh and Northern Irish QCs then?
Well, that's a very good question. We simply don't know at the moment. As everyone knows, we were keen to bring in Welsh, Scottish and Northern Irish lawyers, and the exact way that our legal team will work will only be determined once we know how the inquiry or inquiries will be conducted. But we've got devolved lawyers in place. We're not so sure that the Lady Hallett team does. As I look at their team, they've published a list of QCs. I think there's about 12 of them. So that's the senior barristers in their team. One of them is from Scotland, and one of them has some experience in Northern Ireland, but I don't think is based in Northern Ireland. And as far as I can see, they don't have specific expertise in relation to Wales or Northern Ireland, which is disappointing. But they may bring in further lawyers, and of course, once we know what is happening more generally, we'll talk to them about that, because that's very plainly what they need to do.
Okay, thanks for that. Okay, interestingly, this last one, I'm seeing a couple of these come up in the Q's and A's actually. So the last one's on the Gardner case, last of my general queries. What was the reasoning given by the court for its stance on Article 2, which I believe related to that recent ruling that the way that the government dealt with discharges into care homes was actually illegal?
Well, it was the guidance that the government had promulgated, which was declared unlawful, which is a significant difference. Let me be quite clear that the headline finding was obviously very good and very forthright and very important and very useful. But looking behind the headline, the reasoning in part of the judgment might be problematic for us in the public inquiry. Article 2 is the European Convention right, the right to life, and that is where the obligation on the state to be prepared for known risks to life, that's where that really comes from. So it's extremely important for the public inquiry that is applicable. And the reasoning given in the Gardner case was made on very narrow facts. No problem with that. That's just the reality of the case itself. And so we will be able to fully re-argue that in respect of the wider facts of the public inquiry. But it might raise some problems for us. The reasoning was that the state had put into place a framework of laws and regulations, and that's all it was required to do. I'm afraid I don't agree with the reasoning in the Gardner case on this point, and I'll certainly be expanding it if we have to in the public inquiry and be taking that on. So, I mean, it is a problem. I don't want to suggest at this point it's a big problem, but it is something which has exercised some of us. Okay,
cool. Thank you for that. So I'm just going to ask Elkan to wind this section up with a kind of general what happens next from our point of view. So Pete's told us essentially, the difficulty in predicting what happens next, certainly with timings to the PM, although we hope it'll happen quickly. Elkan, can you just give us a couple of minutes on what you see happening next from our end and what we'll be doing?
Yeah, the first thing that will happen next is Oliver, one of our barristers, will be giving a seminar on the 7th of June on the Gardner case. So if anyone's interested in that, we'll be sending out details, and he'll go into that in much greater detail. Apart from that, there are a few things that the chair has spoken about in her terms of reference consultation summary report, which I recommend as good reading. It's not hard to follow and it's quite interesting. What she has said is Baroness Hallett intends to make an opening statement as soon as possible after the Prime Minister issues the final terms of reference. So once he signs off the terms of reference, she's going to make an opening statement. She will then set out in more detail how we will carry out our work and the overall shape of our investigations, including what we will look at first. So that will give us a better sense of how the inquiry is going to proceed, and most importantly for us, what the first topic will be, which we hope will be preparedness. She has spoken at the various meetings about a listening project, and she mentions it, I think, in this document as well. During the summer, she will be listening to not just bereaved, but other people as well. And again, it's not quite clear what form that's going to take, and it's not clear how that ties in with the usual format of pen portraits given by bereaved of their loved ones. List of issues we've spoken about, we'll be pushing for that to be made public as soon as possible. Now, in some of the meetings, she mentioned that the list of issues would be discussed at preliminary hearings and then finalised so that everyone would have a chance to comment on them. And I assume there will be some form of consultation, whether it's at hearings or otherwise. Pete mentioned devolved inquiries. That's also another thing we'll be looking at quite soon. So there are quite a few things to look at from now to the start of the summer or during the summer. Everything's a bit up in the air still. Timing's very unclear, and the order of things is fairly unclear as well. So that's as much really as I can say about that.
Okay, cool. Okay, well, thank you for that, guys. I'll wrap that bit up there, and I'll just go on to some of the live questions. We've got quite a few coming in, and a lot of them seem to cover whether various things are actually covered in the terms of reference. So let me go through those. So will the inquiry ask the Prime Minister why he repeatedly broke the rules that were enforced on the country? Is the inquiry going to cover that off?
Hopefully, if the inquiry doesn't, I will, because I would very much hope that the inquiry will call Johnson on oath to give evidence. And of course, the messaging has been enormously undermined by his own and his people's dreadful behaviour. So yes, I think that's thoroughly within scope, and I would expect him to be asked.
Right. Okay. Will the inquiry address differing visiting policies when it came to visiting dying family members in hospitals?
Yes.
Okay.
One of the changes that Lady Hallett has referred to is visiting issues. I think she's done it more in respect of care homes than hospitals, but I'm sure it will cover both. Okay, cool. Elkan, this might be one for you. How do people seek help and justice? I think a few people are asking. I guess we've got people on this webinar, some of whom are clients and some of whom aren't. So can you just remind people, or tell people the first time who aren't clients, if they want your help with seeking justice on this, how do they actually get hold of you, and how do they become a client of Brodie Jackson Cantor?
Well, everyone on this webinar will either be a direct client or a member of the group, and the group is a client. So one way or another, they're stuck with us, I'm afraid. So, I mean, if they want to contact us, we can put the email up, but I'm sure it's quite easy to find us anyway through a web link. I'm not sure if that's what the questions are about, or are they about the...
I guess another one, how can family members be more involved in the inquiry as people who've lost loved ones? So is there a way of becoming more involved than through the processes that we've already seen through being a client or being a member of the group.
Yeah. Can I go back a step before I answer that?
Yeah.
Go back to Pete's comment about visiting in hospital. One of the issues about this inquiry is that it will be able to look at general issues, but only to a very limited extent will it be able to look at every individual's issue, purely because of the number of individuals involved. So there has to be a process of abstracting the general from the specific, just to sound like a lecturer. And the way we will do that, and that comes back to how can we be involved, we will go through with all our clients their particular story and take their statements of evidence, assuming that's the inquiry allows us to do that. And I don't really see how they can stop us doing that. We'll then be saying to the inquiry, there are some general issues that arise. Here are the specific facts that raise those issues. And it's then for the inquiry to decide which of the families should give direct evidence on those issues so that the general issues are brought to the fore, if that makes sense. It all sounds a bit complicated, but it's basically seeing what every individual has to say, seeing what the general issues are from that, and then trying to put in the evidence before the inquiry as to the generalities, which includes some specific issues as well.
Okay, I think I understand that. Okay, a couple of different themes then. Why has there been no issues raised concerning the financial impact on families and the lack of help from funeral funds or widows payments? This was raised with Lady Hallett. So question on the financial impact, and that this questioner saying that hasn't been raised.
I think it is mentioned in her summary report. Again, it doesn't necessarily use those words or refer specifically to those people. But I'm pretty sure she's spoken about the impact on the mental health and well-being of the bereaved, including post-bereavement support. She's put that in specifically.
Okay, so that is
I'm sure that will be within scope. Can I pitch in on something I should have made clearer earlier? I'd failed to do so. And there's a helpful prompt in the chat, and it's about the disproportionate impact of COVID on Black and Asian and other minority ethnic communities. I should have made this clearer. We made, many families made strong representations about that, and we followed that up in our document very strongly, saying that in the Prime Minister's draft, there was no specific mention, and the point about disproportionate impact was worded in relation to the Equalities Act or the Equality Act, and included as an afterthought. And so we complained strongly about that, and Lady Hallett has now taken that on board and suggested that that is at the top of the terms of reference, and she has expanded it. She has not worded it in a way that I'm very happy with, but I am completely sure that she has the point, and also the wording that she has chosen does in fact cover the whole area, and we can get that in through the list of issues. So I'm sorry, I should have made that clearer before, but she has taken that on board, although not precisely in the wording that we would have wanted.
Great. Okay, thanks. I'm going to put the last one to you. We've only got a few minutes left to run now. So there's one here on coroner's COVID emergency powers. So do we know what happens with the coroner's COVID emergency powers now? What happens with missed deaths?
You've got me there. Elkan, can you help?
As far as I know, they haven't yet amended the act that limited the power of the coroner to investigate COVID-related deaths. In terms of missed deaths, it's a question, it's not too clear, about people whose deaths were not reviewed at a coroner's inquest because they were related to COVID, and that was the only issue the coroner thought applied. If that's the case, we then come back to the problem that the inquiry, while it will look at general issues, will not look at every specific death. So we have to abstract any general issues that we think have arisen and have been overlooked by coroners and that we think are relevant to the inquiry. And DNR is the perfect example of that.
Okay, thanks. Actually, there is one good one here. We've got a minute left. Do the terms of reference cover the delay in holding the inquiry? As if it was carried out much earlier, valuable lessons might have been learnt, that we could have dealt with the pandemic more effectively and efficiently and saved lives. So does the term of reference deal with the fact that it's happening so late?
Yeah, one of the good things about a public inquiry is that we get the opportunity to make speeches, public speeches, and you can rest assured that that will be very much included in our opening submissions to Lady Hallett, that the delay has probably contributed to the number of deaths. And this is something which the families involved right from the outset in the campaign were pushing very, very strongly, that in 2020, they were saying the inquiry should start now, so that we can learn lessons now because of the inevitable next wave, which of course came. And so, yes, that will be included, but it won't be included in the terms of reference, but it will be included in the inquiry.
Okay, one last one before I get into my wind down here, guys. Can the chair legally require ministers to appear?
Yes, and give evidence on oath in a way that is much more difficult in a parliamentary commission or an inquiry, where it's much less clear whether they can be required to give evidence on oath. But yes, they can be required to give evidence on oath, and I would anticipate in this one that the likes of Johnson and Hancock will be called to give evidence on oath.
Right, good. Right, okay, I'm going to wrap it up there, guys. Unless there's anything you two want to say sort of from there, I'm just going to confirm. Elkan, Pete, do you have anything else you want to add before I wrap this up?
No, it's just that we're very available in terms of if people have questions which haven't been answered. Of course, there's a huge number of people on this webinar. I'm very pleased to see that. But if you haven't had an answer, then please put our feet to the fire. Send us an email, contact us however you want, and we will get back to you.
Okay, well, let me just reassure everyone that the system does capture your questions. So if you've asked a question that's not been answered here, you will get a personal answer by email over the next few days, or actually it might be a week or so. So all your questions will be answered. And don't forget, all of those key points that we've been through are going to be reflected on the Q's and A's on the website. So we've tried to make that modular. So there will be a set just from this, and then there's a general set that should answer all of your Q's and A's as well. So before I just wrap up completely, Elkan, any last words from you?
Yeah, I've got a question for you, Andrew.
Yeah.
I know we run off the Q&A's, but I've noticed quite a few questions have gone into the chat. So can we run that off as well to make sure we don't miss them?
Yeah, I'll make sure that Alina catches those as well. So no worries, we'll get it from both of them. I'm pretty sure with this that she is capturing some as we go along, actually. So any that have gone in the chat, we've got those as well.
Great, thanks.
Okay, thanks very much, guys. So look, thanks everyone for coming. Don't forget, keep an eye on the Q's and A's if you want to keep updated on everything. The recording will be sent to clients next week once we've checked that it's been anonymized. And as Elkan said, 7th of June, Oliver's going to be doing a session, I presume like this, Elkan, on the Gardner case. And if you are on this session and you've received an invite, you will get an invitation to that as well. Any other queries, as I said, by all means, if you don't see what you need to know in the Q&A's, and if you don't get satisfaction through that email, by all means, just come back to us direct, and we'll do everything we can to answer your questions. So thanks very much, Elkan. Thanks very much indeed, Pete. Kind of you to do that. We've hit 7 o'clock on the dot, so I'm going to call it a day there. And we'll look forward to seeing you again if you join us on the 7th of June. So thanks very much, everyone now, and we'll catch you all again later. Bye-bye now.
Thanks.